Going over what the general rules sort of are with the blood tests, the times that people use a swab, you have to have an active sore. So if you've got what definitely looks like a herpes sore, they'll do it. Sometimes someone might have sores that don't look like classic herpes, but they'll send it out anyway. The times that blood testing could be recommended, so when someone has a typical genital lesion, sometimes they'll send it out. If someone has been diagnosed, so on the exam they say, yep, definitely looks like herpes, they send out the swab and it comes back negative, they might have you come back in to do a blood test just to confirm it. If someone has a lesion that sort of looks atypical, they might do a blood test just to double check it. If someone has a lot of lower genital tract inflammation but not any lesions, so something like a lot of urinary tract infection-like symptoms, but they never show up as having bacteria causing it, if they have a lot of inflammation, you can't really find another cause, doing a blood test might be useful to figure out if that's just a really atypical herpes outbreak. Sometimes people will do it as an STD evaluation, but definitely need to keep in mind that your results may vary. You might get a false negative, and if you do get a positive, you have not had an outbreak, how do you deal with that? Some places will do test by request, but it's definitely getting more rare to find providers who are willing to do it. And some providers are willing to test you. If you come in and you say, I have a partner who has herpes, I want to know if I've contracted it, they might run a blood test for you. There's some groups that people are sort of up in the air about whether or not they should be tested routinely. So folks who are HIV positive, it is really common to be co-infected with HIV and herpes, but it's not necessarily recommended to do blood testing as a matter of course. When someone has been sexually assaulted, it's still not entirely recommended to do blood testing. Some providers will and some won't. Same thing with pregnancy. Some people will test as a matter of course and others won't. Really, there's no reason why someone who is pregnant can't have a normal vaginal delivery if they've got herpes, unless they're having an outbreak at the time. But the majority of people, that's not the case with. And then some high-risk populations who don't show any kind of lesions, it's not really clear about whether or not people want to test or not. So it can be hard to access herpes testing is sort of the bottom line. If you don't have symptoms, good luck getting it. If you do manage to get it and you get confusing results, that's really not a surprise. It happens a lot. And you can no longer assume that if you show up positive for HSV1, that it's because you have cold sores. It's pretty likely and becoming more likely that HSV1 is due to genital. All right, sort of tying into this is what the San Francisco Department of Public Health is recommending for their STD testing guidelines. So they revise these about once a year and they try to figure out, based on the previous year, what groups were showing up with highest prevalence of these diseases and who you want to target for testing. So if you were to go into a provider who is part of the Department of Public Health, so city clinic or one of the neighborhood clinics who gets funding through there, and you say, I want to get tested for everything. You need to know what you're going to get when you ask for everything, because you're probably going to get disappointed is what you're going to get. There's two varieties of testing that people can do. So there's what's called a screening. This means that you're testing someone who is asymptomatic. They don't need a diagnostic test. People who need a diagnostic test are in the following categories. So they've got signs or symptoms of an STD. They might have inflamed cervix, inflamed urethra, they might be presenting with discharge, pain on urination, some kind of rash, some kind of sore. Those people are going to get a diagnostic test. Someone who comes in and they say, I know that I've had sexual contact to an STD. Now, working in this field, I can tell you that pretty much everyone thinks that they've had contact to an STD. We're talking about people who get the call from a partner who had DPH, hunt them down and say, you have this STD, you need to inform your partners and get them treatment. So that's known contact to an STD. And then people who've had prior infection, if you come in and you say you've had a history of chlamydia or gonorrhea or syphilis recently, you will get retested at a few intervals to make sure you've cleared the infection that you're cured. So they break this down between women, men, and trans people. And if you're going into one of these DPH clinics and you would like to be tested, here's what you will get tested for. So these are just screening guidelines. So people who fall in the diagnostic categories can get a test regardless. If you have no symptoms, you're just requesting testing, here's what you're going to get. If you are a woman and you are 25 or younger, you will be tested for chlamydia or gonorrhea about once every 12 months when you go to your provider, oftentimes whether you want to or not. In terms of syphilis, it is not recommended to screen women in San Francisco, period. So if you're a female and you want a syphilis test in San Francisco, it's going to be hard to get it if you go to a Department of Public Health clinic. If you're female and older than 25 and you would like to be tested for any of these without symptoms, you will have a hard time getting it because it is much less common in these age groups. If you are pregnant at any age, you will get tested for all of these. That is just pretty much routine, and that is whether or not you plan to carry to term or not, you will get tested for these. And then if you want to get an IUD insertion, you will be tested for gonorrhea and chlamydia, but probably not syphilis. So I know probably people are up in arms and they think this is very not fair, right? Like, who's pissed about this? Okay, I'm going to show you the numbers that I'm going to show you later why we don't test people for this. Like, there's 5 cases of syphilis among women in San Francisco a few years ago, and I got a call from someone at the Department of Public Health that was like, they do an STD update every year. They're like, God, I really hope you're coming to this because I know you work in women's health and we're just having an epidemic. I'm like, yeah, 5-person epidemic of syphilis in women in San Francisco. All right. Not really the groups who are getting it. So we're going to take a look at who is. If you are a male and you would like to be tested, if you go to a Department of Public Health clinic, you are going to get, if you are a man who has sex with only women, nothing. You will have to present with symptoms at most of these places if you would like to be tested. You might be able to find some places that have, say, a family pack provider who can bill the state for your testing. They may or may not do it. If you have private insurance, chances are you've got a much better shot of getting tested for these things. The Department of Public Health would like to not test you because that way you take away from their numbers, so we look like we have a lower prevalence and we're less likely to get funding from the government. So if we present with really good numbers, we get more money. So those of you who are not at super high risk are getting denied because you keep our numbers low. If you are a man who has sex with men and trans women, you will be offered the following tests all the time. So rectal and pharyngeal chlamydia, gonorrhea, you will be getting those tests a lot. They have sort of a funny chart here. So syphilis is not rectal or pharyngeal, it's just a blood test. So it's not necessarily going to say where on the body you had a chancre. But it's recommended if you're a man who has sex with men and trans women that you get all 3 of these every 3 to 6 months. In terms of urine testing, they actually don't recommend for chlamydia or gonorrhea that you do urine testing. They're really mostly interested in rectal and pharyngeal testing. So that's in the butt and in the throat. Once again, this begs a very interesting question. If we're not testing urine, which comes out of the penis, where are these cases coming from in people's throats and in their butts? They have to be coming from somewhere. So it's not just bottoms who are getting this. We're kind of missing a little bit of a link here in terms of where STDs are coming from. So women are getting it from somewhere. They're not just giving it to each other. They're getting it from somewhere else too. And I don't know where butts and throats are getting it, but penises aren't. But a little bit of a missing link here. So just know it's going to be a frustrating experience for people who are going to Department of Public Health clinics and want certain kinds of testing. They have testing guidelines for trans men. They did not release any guidelines for trans women. And what they are also recommending is chlamydia, gonorrhea, syphilis screenings every 3 to 6 months. And they are recommending either a urine test or if someone has a vagina, a vaginal swab every 3 to 6 months. And so they're presuming that trans men are all bottoming as well. So not necessarily testing based on any kind of behavior, but they're just testing based on what group you fall into. And this is also regardless of age. So this is not based on 25 or under, 25 or over. This is at any age that they're making this recommendation for. So I'm just breaking the news to you. I didn't make these recommendations. I don't love these recommendations. I'm just telling you what's out there if you want to go to a DPH clinic for testing. All right. I want to do just a little bit of epidemiology. I want to give you a little bit of background to the terminology we're going to use for it. When we're talking about occurrence of a disease, there's sort of 2 ways you can report this. First is the incidence, which is the number of people in a population who develop a disease during a particular time period. So this is an indicator of the spread of disease. So we're talking about the incidence over a year when we talk about things like gonorrhea, chlamydia, syphilis. We'll say the incidence in 2008 was this. If we're talking about the prevalence, that's the number of people in a population who develop a disease or have a disease at a specified time. So when we were talking about those herpes cases and saying 17% of people are seropositive for HSV2, that's the prevalence. So this talks about regardless of when it appeared, takes in new infections as well as old infections, and talks about the entire population having it at this given time. This can tell you a little bit about how seriously and how long a disease has affected the population. So when we were talking about the NHANES study that showed people had 21% seropositivity a few years ago, and now it's down to 17%, we're talking about prevalence and we're talking about the trend that the disease has followed over those years. Also, when we're talking about terminology, we're going to talk about infections and diseases. And this is something that's a bit of a sticky issue, and I know in CISI we tend to say STD, giving you a little bit of an argument why you might want to think about the word STI instead. So an infection means you're colonized by a pathogenic microbe. You can be infected with something and not have a disease. A lot of people who have infections of some kind of sexual variety can still function pretty well. It doesn't interfere with your normal daily activities. Some people might just have mild symptoms or might have nothing at all. You can still be contagious if you have an infection but not a disease. So when you've got a disease, that means you are showing signs and symptoms and you've got a change in your state of health to an abnormal state. When you've got a latent disease, this could be the case. You could have a chronic disease and this could be the case. So the difference between an STD, if we were talking about an STD, this means that it's really affecting your change in your state of health versus an infection, which is something that just means you've got these microbes living in your body. Definitely know what your clients are using. Some clients are going to like the term STD, others are going to like the term STI. I know that the whole move to try to say STI instead is one that's both accuracy but also trying to destigmatize STIs. What this ends up being is confusing for a lot of clients. They assume that STIs are no big deal, so they don't need to tell their partner about that chlamydia diagnosis and don't need to get them medication for it too and end up reinfected with chlamydia. So just be aware of what your client is saying and follow their language, but know that the field in general is trying to move more in the STI direction than STD.